Mark Brook, a doctor at Dayton Children's Hospital, told me they went from about 80 COVID tests a day in July to more than 900 tests a day over this past week. And more children are being seriously affected by COVID. Doctors say we do have the tools to protect children and they want us to start using them. The Delta variant is filling children's hospitals across Ohio with patients.
We have twice as many children in the hospital now as we ever had a year ago with COVID. And some of those children are in the ICU, and some of those ICU children do require ventilators.
At Nationwide Children's Hospital in Columbus, there are approximately 20 children in the hospital with COVID. 5 of them are in the ICU and 2 of them on a ventilator. The chief medical officer of the hospital says at least one of the children did not have any underlying health conditions.
In fact, it does happen that children who are generally healthy do get COVID and can get sick and end up in our intensive care unit.
Dayton Children's chief medical officer says data shows children are at a serious risk from the virus and its variants, but vaccines, social distancing, and mask wearing could keep children protected.
Here's what makes me encouraged and also somewhat frustrated. I think we have the tools to make it go. We're just not using them.
This week, both Dayton Children's and Nationwide Children's joined more than 60 other children's hospitals and the Children's Hospital Association to call on leaders in the private and public sector to take more action to protect children.
We are seeing more and more that, certainly with the Delta variant, that kids are getting very sick. So whatever we can do to prevent that, we will do and support.
Pediatric doctors say they're also seeing an increase in the number of children in the hospital with RSV, and that's unusual at this time of year. Usually they say outbreaks are in the winter, but vaccines and masks can also help protect children from this respiratory disease. In the studio, Aaliyah Williamson, 2 News, working for you.